Hi, good evening. Austin Mayor Steve Adler. We're going to go over the numbers tonight on COVID, touch real briefly on a new opening that took place today, touch on one of the bills up at the state legislature. But let's go ahead and begin with the numbers that we all see and what has been the basis for this for the last year. By the way, trying to decrease the frequency of these guided minutes just a little bit because we're not having a lot of new information to report. I think we're going to be kind of moving to kind of a Monday, Wednesday type schedule. That's why we weren't with you last night. But we're going to bring you Dr. Escott's and Dr. Director Hayden Howard's information tonight instead. But let's take a look. 23 new admissions. You know, we have been bouncing around this 20 point. We got down to 18. We went up to 20, 21, 22. 23 new admissions. It's below the 7-day moving average of 19. I wish we were dropping the number lower. The positivity in our community, though, didn't really go down. It's been in that 4.3, 4.4 range. We'll see that in a second. This week at 4.5 is the number that we're seeing. So it's basically stable. 135 new cases today. That's above the 7-day moving average of 120. You know, what we're finding is that even though the case number has kind of plateaued out and hasn't been dropping the way that I or any of us wish that it would, what we're finding is that the cases, when they turn into a hospital admission, don't result in the same percentage of deaths as we were seeing in the past. So the mortality rate is something that's going down pretty substantially, both for the older members of our community as well as the community generally. Similarly, when someone goes into the hospital, what we're finding is that the length of stay on average for people is also going down, not by quite as much as the mortality. So we're seeing that as well. So the numbers are going down, and the threats to our hospitals seem to be something that is lessening as we go through time. But you can see how the numbers here kind of flattened out. 18.9 is the average today. That's why we said 19. It was 19 before. It's gotten down to 16, but also up to 21 here, and just 2 weeks ago it was up at 22. So it's staying in that general area. Let's take a look at the second dashboard that we go to, so we can take a look at those hospitalization numbers in the city and in the county. You can see that the number of people hospitalized is 140. The 7-day moving average is 139. So we're just one above the 7-day moving average. Number of people in the ICUs, census today is 51. The 7-day moving average is 52. So we're just one below that, basically flat. Ventilators, 24 people on ventilators, 7-day moving average 25. So again, the numbers are basically flat. Number of deaths, 821. That's the same number that we had last night. And as you recall, that number is 2 more than what we had on Monday night. So last night the number went up by 2 people that had passed away. Today there were no additions to that number. Let's go ahead and then get to Dr. Escott's numbers so that we can see his, and then Director Hayden's numbers. This is the data dump that we usually have on Tuesdays. That's why this information here is dated April 6th, because it's from yesterday. This is the chart that we see of new confirmed cases. You can see really how we have leveled out in the community if you look in the bottom right hand of that chart. This is new admissions, also generally flat. We dipped down a little bit, but we're generally staying at about the 18, 19, 21 place. This is admissions in the blue at the top that you can barely see. The orange is ICU admissions. The gray is ventilators, again, flattening out. This is the most recent numbers from Dr. Myers at the University of Texas. Again, what it's predicting, the dots are the actual numbers, the lines on the right are what is predicted from those numbers, and again, generally flat. Also with hospitalizations, generally flat. The number of hospital admissions is what we use to be able to target going to the next level. And at this rate, it doesn't look like we could get down to blue since we're leveling off until maybe early May, late April, early May. Wish we could drive down those numbers. We still have to be careful, wearing masks, most importantly, getting vaccinated. We're in a race to get as many people vaccinated as we possibly can before variants take hold, and we have to keep transmission down while we're doing that. This is the chart that shows us hospitalization by age group. Remember, for the longest time, we had 3 different groups. The older folks in our community were in a group by themselves, the middle-aged folks in a group by themselves, and then the younger folks going down. What we're finding now is that these are percentages, not absolute numbers, but the older folks' numbers are coming down, generally speaking. The under folks' percentage, the middle-aged folks, a bigger part of the percentage, and I think that's because we're seeing so many of the seniors in our community getting vaccinated, certainly those over 80. The folks most likely to go in the hospital, we've done a really good job from an age perspective. We still have to do a better job with respect to race and ethnicity. We'll see those numbers here in just a second. These are the absolute numbers that go with the charts you just saw. Folks 80 and above, hospitalizations at 119. We were 32 just several weeks ago, down to 10. 34 for the next age group, 70 to 79, down to 22. We've seen a rise in those folks that are 60 to 69, but still within the general numbers that we've been having the last several weeks. We need more of those folks to get vaccinated. Even though the blue numbers here, 28 in this age group, 50 to 59, used to be 36, but it's a higher percentage now because it's 28 out of 154 as opposed to 36 out of 194. That's why you see those percentages that are rising, even if the absolute numbers are not. This is hospitalizations by race and ethnicity. The blue group that showed the increase is white, not Hispanic. The green group that has come down is Hispanic, all races. It's gotten down here to 42, 43%, higher than the percentage in the population, which is in the mid 30s. So you can see that African Americans still lagging up at 14.2% in a community that's about 8% of our population. So nearly double the incidence in our community. This is a concern. That's why Austin Public Health is really reaching out right now to get vaccines in some of the kind of the institutions on the east side of town, churches and the like, to really make sure that we can get to the African American community. Austin Public Health, the county, community care, all reaching out to really add the equity to a community that's having more and more vaccines being given out by grocery stores and pharmacies, where you're not going to get that same kind of equity work. This is the absolute numbers. You can see the numbers of Hispanic all races down at 59, was 76 not too long ago. We reached a low point here 2 weeks ago, went up, came back down again. Population of white, not Hispanic, at 60, about the same last week, 58. But as the number goes down, the percentage goes up. That's why you saw that increase. African American, about 20 total number. It was 20 before. The reason the percentage has gone up is because the total number has gone from 181 down to 141. We should be seeing a corresponding drop there, and we are not. This is positivity in the community generally. You can see this is 1 month, this is 2 months. 3 months ago, we were up at 14%. That's when our ICUs were facing risk. Now down to 4.5. You can see it's been fairly stable and level for the last 5 weeks, but we're trying to get it below 3% is what we're trying to do. Certainly below 5%. You can see that the number here, Native Hawaiian or other Pacific Islanders, has gone up, relatively small number, so an increase of just a few people will give you a really high percentage increase. This is the Latino population, and you can see that it's been fairly constant by way of percentages. We have an increase here in Black or African American. We saw that a second ago, not in absolute numbers, but as a percent of the whole, a bigger portion of that. This is the same kind of chart by age group. You can see we used to be really high at the right side as people were older. You can see as people are older now, not facing the same thing as out to the right side of that chart. Vaccinations is what's helping with that. That's going to force the percentages up in other places. Good to see the 10 to 19 age range come down to below 5. Not good to see the 20 to 29 age group going up. This is the percentages that you see. High school at 5.9% is higher than what we're seeing in the community generally. That's the 4.6 number. But middle school, elementary school, and preschool, the positivity rate is below what you see in the community generally. These are the numbers looking at cases in the last 7 days in our long-term care facilities, nursing homes. 4 cases in the last 14 days. 13 cases in the last 28 days. That's a 98% increase from where it was just at the beginning of February. If that's not conclusive proof to the power of vaccinations and why everybody should be getting vaccinated, there is no better. That is about as good as the data gets that corresponds to what the doctors are telling us. If you get this virus, I suggest that you ask your doctor or physician to see if this regional infusion center is available to you, still has greater capacity than people using it. If I were to get the virus, this would be the call that I would want my doctor to make for me. This is the treatment that the president got, and it is being underutilized in our community. These are the flu numbers, just to confirm that flu is staying down here at 1% or lower at a time when this is what you would normally see in our community. In the 2017-18 season, we were up at almost 12%. We had a lot of people dying because of influenza. We're just not seeing that. It's because people are wearing masks and taking better care. We're still not out of the woods. There's still sometimes a late surge here, so we still need to, we're not quite out of the flu season yet. You can see we're still firmly ensconced in risk level stage 3, which is 10 to 29, and we've kind of plateaued and are just holding regularly in the 20 range. But that's the update that we got from Dr. Escott and Director Hayden. I want to touch on just a couple things. Important to continue wearing masks when you're around people. CDC says that if you're just with people that have already completed their vaccinations, 2 weeks their last shot to have complete vaccinations, it's okay to be indoors with them if everybody is like that without a mask on. But otherwise, when you're out, even outside around other people, still best to wear masks if you're around anybody that hasn't been vaccinated or if you haven't been vaccinated. A wonderful thing today for me, I was out at the Waterloo Terrace grand opening, new project with Foundation Communities. It's the newest affordable housing development, 132 units. They had 1,300 people sign up to try to get these units. Just shows you the level of need. It's a beautiful, beautiful property, beautifully set up. Courtyard in the middle in the kind of a contained space. It's tiered. Had a chance to meet some of the residents who spoke glowingly of that project. There's on-site support services for case management. There's a food pantry. There are computer classes, a fitness room. There's a pet grooming area. Some of the residents find companionship and attachment with pets, as we all do. Permanent supportive housing is an absolute necessity when it comes to reducing the number of unsheltered people experiencing homelessness in our city. And some of the residents in this project are folks that don't have to be in tents now out on our streets, but are put in homes where they can take advantage of these kinds of services. You should be proud as a resident of this community. This was funded in part by the Affordable Housing Bond that we all passed in 2018 with 73% of the vote. Made me really proud to see that vote of the community. It is a compassionate, caring community that we live in that really wants to get people into housing. I also want to thank Austin FC, the soccer team. The commissioner was in town today taking a look at the new stadium. It's pretty impressive. I am a real supporter still of Austin FC, that soccer team, because I think it's going to be something that helps pull our community together. There's too many things in our lives right now that are trying to pull us apart and separate us. But to have a professional team in our city, I think will be one of the things that pull us together. People will be out. You'll see people wearing the same colored T-shirt you're wearing, and it pulls people from all different places in the community, all cheering and rooting in the same way. But anyhow, they're doing their part to be part of the community. Austin FC is, as they promised that they would, and I just mentioned them because their $500,000 was one of the lead gifts for that Waterloo Terrace property that opened today. So thank you to Austin FC, but thank you to all the other donors that participate with Walter Moreau and his organization and staff and help make those kind of things possible. We need a lot more of those. And then we can move people out of tents and into places where they can really set up their lives. Last thing I want to talk about on a similar subject, House Bill 1803, bill that was considered in the House today by the committee. It's a bill that would be, if it passed, a major setback for getting people out of tents and into housing. It has a lot of red tape and delay that would make it more difficult for the city, more expensive for the city to acquire permanent housing solutions that are on the marketplace. As a city, we need to do a better job than we have in the past of when we're in that confidential stage of negotiations, giving a heads up to some of our other government partners and peers, and we just need to do that. But at this stage, when you're negotiating early for a price on a piece of property, it's not something that you do in public. Heck, you want to try and make the seller think you're looking at their property and 6 other properties so that they give you the best possible price, so the taxpayers don't pay a penny more for a piece of property than they need to. Of course, before the city should ever commit to actually buying the piece of property and executing to close on a contract, there should be full and open and vigorous community input. But at that stage where you're just getting that initial contract before you have the debate about whether you should close, this bill would make it very difficult for us to get the best deals or prolong the process. It would make it less likely that we would be able to find the spaces and the properties that we need. And I think we live in a community where people want us to do everything we can to get people out of tents and out from under overpasses, not forcing them back into the woods or our streams, but actually getting them into housing. And this bill, 1803, would make that more difficult to do. Being considered by the House, I sure hope the committee doesn't let it out because we need help in housing our population that's experiencing homelessness. I'm going to conclude vaccines tomorrow night. I think beginning at 6 o'clock, you should check. Austin Public Health is releasing first dose appointments for those that qualify. I think it's pretty much 1A, 1B, 1C. It's childcare providers and educators. It's also individuals over 40. But last Thursday, they actually had more vaccinations and they had people sign up on that night. Of course, all the extras were given away the following Monday. But on that Thursday last week, there was an opportunity, more vaccines available than people going there. So I urge everybody to consider doing that. If you don't have a vaccine, get it there, get it somewhere, but get it somewhere. Get it other places, but whatever, get it somewhere. We need people to vaccinate. In the meantime, while we're getting the vaccinations, please recognize this virus is still with us. We are not out of the woods, so continue to take precautions. We don't have a lot of time left, or we're going to have to do this. But if we want to avoid what's happening right now in Michigan and other places, let's be vigilant and really do take care of one another. Thank you so much. You all take care. Be safe, and good night.